Good deal. Dr. Brandeis, thank you for joining the Pain and Performance podcast.
Oh, it's my pleasure to be here. Thank you so much for having me.
This is an exciting topic. I will give you like full disclosure. We kind of share the information with our staff and tell them like who's coming on. And I got more questions and like this twinge of excitement from this one that I've seen in a while. So I'm excited to dive into it. So you, for many years, practiced as kind of the traditional urologist, correct?
I did, yeah. So, I finished residency at UCLA in 2001 and went straight into private practice. But, I was always sort of on the cutting edge of stuff. So I was one of the first in the country to do a robotic prostatectomy. I was one of the first to do an MRI-guided prostate biopsy. So I always like to be 2 or 3 steps ahead of everyone else in the community.
So you did that. I mean, it sounds like, obviously accomplishing some of those things. You were at the kind of maybe front end of the field for some of that. Was there a time where you started to say, like, maybe I want to shift gears? What was that, like, aha moment that, made you think maybe I'm going to shift my focus a little bit?
I learned about low intensity shockwave therapy for erectile dysfunction. And, we, as a urologist, we give out lots of Viagra and Cialis and those kind of medications, but there are a lot of folks that that doesn't work on anymore. And so, those guys just kind of look at you with these puppy dog eyes and you can talk about a penile implant or you can talk about injection therapy, but really there had to be something in between that and the regenerative therapies for erectile dysfunction, including low-intensity shockwave therapy, platelet-rich plasma, the possibility of stem cells, peptides, and those kind of things really got me interested. And so about 3 years ago, I decided to leave the world of general urology, of kidney stones and prostates and urinary tract infection, and really dive into the treatment of men with erectile dysfunction, but then also medical research into these kind of treatments.
One of the things that got me kind of interested in this is we started seeing quite a few of these kind of post-COVID cases. A numerous kind of issues that some of these people were dealing with. And what they started telling us was, an overwhelming number of them were starting to experience the speed at which it came on was erectile dysfunction really changed after COVID, and especially in these kind of, long hauler type cases. And so it just piqued my interest. And then we kind of connected and I was like, there's a much deeper level to this than I think people are talking about. One, because we don't like to talk about this, right? Like, men, if you ask men if there's a problem, and thank you for doing it. But one of the things in listening to a lot of your information is this is much more prevalent, not just to mention the COVID thing, but just in general than I think most people would have you think. Like you were talking about a study where it's like 40% of 40-year-olds have some form of ED, 50% of 50-year-olds. Like that's way more prevalent than most people would have you think.
Yeah. So first of all, you bring up a great point, which is that COVID causes erectile dysfunction. I think one of the failures of the public health establishment in this country is they never really taught Americans what COVID actually was doing. So COVID causes a vasculitis. It's an inflammation in blood vessels. And so that's why people got COVID toes. That's why people got heart attacks. That's why people got strokes. And that's why people get erectile dysfunction, is because it causes an inflammation within blood vessels, and especially in small blood vessels. And the blood vessels going to the penis are 1 or 2 millimeters. So I was at the Sexual Medicine Society meeting last year, and there was an abstract of a study that showed that there's an increase of 20% of new diagnoses of erectile dysfunction in people that have had COVID. And I'm sure that underestimates that number.
Yeah, well, and I mean, even, look, if we're talking about these numbers, the people who've been affected the most are probably your 40, 50, 60-year-olds that weren't terribly healthy to begin with. And so if you take that study of 50% of 50-year-olds have it and most of them get it, that's a huge jump of 20%.
Yeah, absolutely. And, you bring up another great point. And so what I tell people is your penis basically is an excellent barometer of your overall health. It really is.
That's nice.
So, okay, you're 20 years old, you're at your prime, you're playing football or basketball or doing whatever you do. Every morning you wake up with a great erection. Okay. At some point, you're going to lose that morning wood, right? So what does that tell you about your health? What that tells you is that your circulation isn't as good, isn't as optimized as it used to be, right? And so from that day that you realize nighttime erections went away to the day when you're with your partner and things aren't working so well anymore is about 10 years, right? So you got 10-year head start. Now, from the day that you have erectile dysfunction with your partner or your spouse to the day you develop heart disease is another 10 years. So you got about 20 years of early warning before you develop heart disease, right? Because the thing is, the blood vessels going to the heart are about 3 to 4 millimeters. The blood vessels going to the penis are about 1 or 2 millimeters. And the blood vessels that go to the heart are the first ones that get blood. The blood vessels going to the penis are the last ones, right? So if you're 35, 40 years old and you're losing nighttime erections, you got to think, okay, what's next? What's next is 5 or 10 years from now, you're going to lose erections when you want to get them. And if you bury your head, that's why I don't like Roman and Blue Chew and all these online services, because they don't actually provide you with medical advice. So if you go to a good doctor who will actually sit down and talk to you about what's going on in the cardiovascular system, they'll tell you that you're starting to get clogged in the blood vessels. And listen, I've been to Jazz Fest. I've been to Louisiana. I lived in Nashville for 4 years. I know that sausage biscuits and gravy is a meal that people eat. I've had crawfish beignet and all those kind of things. And I know that I have a picture that I show my patients. My house is about 50 years old, and my sink got clogged. And so I'm a do-it-yourselfer, so I'm sticking the snake down there and trying to unclog it. And finally, I just had to call the plumber, and the plumber came and he cut the pipe. And the pipe was 3/4 clogged with old grease and stuff that you wash down the sink. But, it occurred to me, which is why I show it to all my patients, that's what your blood vessels look like, right?
Right.
And so, you look at the picture of the pipe under my sink and you're like, oh, God, that's gross. But you know what? When you do a carotid endarterectomy or you take someone's heart vessels, it looks the same.
Yeah. And that's when we look at those things and we talk to people about improving the function. So you talk about like the young, person who first starts to realize, hey, I'm not waking up with an erection as many mornings as I used to. And now it's actually becoming more rare. Like there's two avenues that I'd love for us to dive into. What does that person start to do that will affect them in their 40s, 50s, 60s, 70s in a positive light? What should they not do? And then if we're already there, what can we do? But let's start at the beginning, since we're kind of talking about the person who's starting to notice it. What are some of the things that these younger people are doing that they don't realize is sabotaging their sexual health whenever they get into, the older ages?
Yeah. So, my wife gets me these Costco protein bars. So don't worry, there's a point to the story, right? The Costco protein bars, there's like 4 chocolate protein bars and 8 peanut protein bars, right? And I don't really like peanut butter. Right. I don't know why she keeps getting me these protein bars. But anyway, like, of course, I open them up and I eat the first 4 chocolate protein bars. And then after that, I get all the 8 peanut bars. Right. And they're not that good. Right. So I'm front loading all of the good stuff. Right. So and then, So I'm eating the protein bars, a couple weeks later, and I'm like cursing myself from 3-4 weeks ago for eating all the good ones, right? That's what we do to ourselves, right? When we go to Jazz Fest and have too many beignets and too much beer, and maybe you're smoking, and maybe you're not working out, and maybe you're doing some other things that would be detrimental to your health. You're having a good time at that moment, and especially when we're young, when we're in our 20s and 30s and early 40s, we can get away with it. But when you're in your late 40s or 50s or 60s or 70s, you're going to pay the price for the bad decisions that you made when you're younger. So, when you're 65, you're going to be cursing your 35-year-old you or your 25-year-old you, saying, why were you out partying so much? How come you weren't exercising? Why were you smoking? Why were you doing all the things that messed me up? Right?
So you're like, there's no way that was worth it. Like that extra drink was not worth it. That extra beignet was not worth it. So is it everything that would create vascular problems that we need to really pay attention to? And my other part would be, can we identify people through some testing how resilient their vessels are, so you kind of know which route you need to be in?
Right. Well, you can do all the testing you want in the world, but I can tell you in 15 seconds the formula for excellent health. You interested?
Let's give it a shot.
This is bomb-proof, right?
Right.
Don't drink alcohol. Don't smoke. Don't do drugs. Don't eat too much. Exercise every day. Stretch. Get good sleep. Do a little bit of meditation. And be nice to other people. Right?
That's a pretty good list.
If you do all those things, you're going to be ahead of 95% of folks. And there's reams of evidence that back up those nine statements. Pretty much it won't cost you anything to do those things. The problem is we don't do a lot of those things, right? Because we live in a stressful world, and there's marketing people that are telling you, if you don't drink beer, you're a loser. If you don't drink wine, you're unsophisticated. If you don't smoke cigarettes, you're not masculine or whatever. But in the end, we all know, I have patients that kind of look at me and they say, well, isn't red wine good for you? I just kind of look at them and shake my head like, are you really seriously asking me that question?
Well, marketing is very effective, right? I mean, you look at even the marketing behind like Viagra, Cialis, some of those things. I think a lot of times we're a quick fix society. We want to fix these things as quick as possible. And that list, while easy to say, difficult to do for a lot of people, because that's a whole lifestyle change behind everything that they're trying to do. So if somebody tells me that you have a quick fix, I'm like, well, shoot, I'm going to give it a shot. Yeah. But there's a deeper issue. And I think whenever we solve the actual underlying problem, and this goes in health and pain, in sexual function, it's always better in the long run to actually get down to the root cause of some of these things. So if somebody is actually already in that point, if somebody already is experiencing some of these things, there's a lot that modern medicine has to offer. Let's dive into some of those things. What are some of the things that actually helps once we get to that point?
Yeah, absolutely. So, when I do sit down with my patients, I do spend a lot of time with my patients, and because I don't take insurance anymore, because I think that you really have to spend a lot of time with these type of patients in order to get to the root cause. And I almost refuse to treat patients that don't want to make lifestyle changes that I think are, because the thing is, like, at the end of the day, I want my patients to be happy. And so if I put them on pills or I use technology on them and they get better, they're not going to be better for very long if they keep making bad lifestyle choices. And I think that's one of the things that I've been very successful with my patients is, I'm a midlife guy. I'm 55 years old. I've been through a lot of this stuff, and so I can look at them and just empathize with them and say, listen, life gets rough. Marriage is difficult these days, and kids are tough, and the workplace is tough, and it's hard to make good choices all the time. Let's work on weight. Let's work on getting back into shape. Let's work on building muscle. Let's work on getting your testosterone levels up. And I've gotten really, really good responses. Now, in terms of what can I do in the moment? Okay, I have an algorithm that I go through with my patients. And so first of all, there's a supplement called the nitric oxide booster, right? So when I was at UCLA, one of my professors won the Nobel Prize for figuring out what nitric oxide did with blood vessels, and a friend of mine wrote the paper that described the mechanism of action of Viagra. And so, not to bore you with a long biochemistry lecture, but basically nitric oxide comes from two sources. One is citrulline, which is plentiful in watermelon, and the other is nitrates, which are plentiful in beets. And your body gets about half from citrulline and half from nitrates, and it makes this chemical or molecule called nitric oxide. And nerves release nitric oxide, and it makes this stuff called cGMP. Now, you don't really need to know what cGMP is, other than it's kind of the linchpin of the whole system. So the higher the level of cGMP, the more blood vessels open up, and the lower level of cGMP, blood vessels get smaller. Okay, and what breaks down cGMP is something called PDE5. And the brilliance of Viagra, Levitra, Cialis is that they're specific to PDE5, and PDE5 really is only found in the penis. So nitric oxide boosts blood flow everywhere. PDE5 inhibitors only boost blood flow in the penis. And the two of them work synergistically. So I make sure, so I actually formulated and sell a nitric oxide booster called Affirm, which is available on affirmscience.com, that has both of those pathways. So I put all my patients on Affirm, and a lot of them I put on a PDE5 inhibitor. And the nice thing is these things are now generic. You shouldn't pay more than $1 a pill for any of them. And I make sure that they take them before they go to sleep, because I want them to get nighttime erections.
Nice. And so in those situations, whenever somebody is starting that kind of full routine, they're starting to get into some of those, is there something that people should be adding on to that makes these more effective, that makes it, like the, PDE5 inhibitors better?
Yeah, well, I mean, that's what the nitric oxide boosters do.
Okay.
So I get a lot of patients that say, well, I was on Viagra and it seemed to work, but now it's not working as well before. And a lot of times, they're asking me, is there a tolerance to Viagra? There's no tolerance to Viagra. What it is you're making less nitric oxide. So you're making less cGMP. And so if you don't have cGMP, you could take all the Viagra in the world, it's not going to work.
Yeah.
But that's only the boosts the signal.
Right.
Now, the other part of it is to improve the pipes, improve the arteries that are delivering blood to the penis, right? And you have to understand what's going on inside the penis to understand why this is important, okay? So arteries pump blood under pressure. And so when a guy is stimulated, he's pumping blood through these arteries into the penis. And as the penis fills with blood, it blocks the veins on the periphery of the penis, right? And veins have passive flow. So a pressure in an artery might be 120/80, but a pressure in a vein is just like 6 or 7. So they're easily constricted. And so the idea is to get enough pressure into the penis that you're constricting the return of venous blood back to the penis, but you're continuing to pump new blood into the penis. And that's why the penis goes up, and that's why it, so the penis is the only organ in the body that moves entirely based on blood flow, and it's the only organ in the body that has skin but no muscle.
Yeah, it's such an interesting thing because we talk about like the Myers study where they did all the pelvic floor systematic review and find like building up the muscle of the pelvic floor improves, I think it was like right under 50% of erectile dysfunction. And having that muscle tone in there has to be able to, you know, kind of, I think two parts. If you're doing the training, you're probably improving the pipes in some way anyway, right? We're improving blood flow to that area. And then being able to have the muscle tone to get some pressure in there and maybe help out some of those areas that might not be as healthy as we would like them to be, probably improve some of it. But it was a very interesting study that just men going through these strengthening, like kind of Kegel style exercises improved ED by like, you know, 47, 50%.
Yeah, it's actually interesting. So I'm doing a clinical study right now on a device made by a company called BTL. I don't know if you're familiar with them. This one's called the M-Cella device. The others are called the M-Sculpt devices. And they use high-intensity focused electromagnetic waves to contract muscles. So it's, you know, like a TENS device uses direct current. So direct current takes the path of least resistance. It also goes superficially through the skin, and that's where all the pain and temperature receptors are. So, and then it takes the path of least resistance through the muscle, so it doesn't go deep into the muscle. And so these devices use an electromagnetic field that goes deep into the muscle. And so you can contract the pelvic floor 10, 15, 20 times more intensely than you would be able to do it on your own. And then the protocol lasts for about 28 minutes. And so at last year's Sexual Medicine Society meeting, I presented data on ejaculation. So showing that it improved the intensity and duration of ejaculation, which, you know, I mean, I have guys in their 60s that don't ejaculate anymore. So, I mean, these guys are just overjoyed with the results of the study and the benefits that they've accrued from this. And then this year, the company was so happy that we're just finishing up the study looking at improvement in erectile function, like you just talked about, and ejaculation and even urination.
Wow. By
using this deep field electromagnetic therapy.
What's the application? Is it through like a paddle or a little small applicator?
Yeah, so with the pelvic floor, it's a chair, so you basically just sit on it. So you're basically sitting on a 2 Tesla magnet.
Yeah. So and that coil is what directs it.
Exactly.
Interesting. Exactly. So it's like a crazy souped up like PEMF in a way. Similar
technology, but it's a 2 Tesla magnet, which is a pretty intense magnet. So the other study I'm doing is on industrial athletes, so police, fire, SWAT, corrections, and I'm showing a 10 to 15% increase in muscle mass of the biceps and triceps with 6 treatments.
That's amazing. What's the device called again?
It's called the M-Sculpt.
M-Sculpt. Yeah, I'm not familiar with that. We'll have to check that out.
Yeah, it's really wild. I personally, over the past year, I've put on 5 pounds of new muscle and lost maybe 5 or 10 pounds of fat, and it's mostly due to this device. And that's pretty typical for my patients. I have patients mostly over 50 or 60 years old, and it's not unusual that I'll get 5 pounds, because I have a sophisticated body composition machine, so I'll get my patients to put on 5 or 10 pounds of new muscle and take off 10 or 20 pounds of fat. What is your thoughts on some of these other kind of devices out there? Like, we'll treat a low back pain patient, and we often combine our treatment. So we're doing a kind of integrative, pain and regenerative therapy. And so we'll do some like deep dry needling stuff across all the nerves through the pelvis. A lot of times they're doing PEMF blood flow treatments through that area. And some of them may be doing like cryotherapy and sauna or something to that effect. And then we're trying to clean up, diet and stuff. And a lot of them will come back and say like, my erections have changed, and I didn't even tell you that was a problem. For me, if I had to point it to anything, certainly improving the health and the blood flow with needling and PEMF, that would be the stuff that I would point to as actually moving the needle on it.
But have you seen any science on that? Do you have any anecdotal kind of evidence of using any of that?
So the nerves going to the penis are from the lower sacral nerve root, so S2, 3, 4. And so if you're stimulating the sacral plexus with some sort of energy, whether it's electromagnetic or PEMF or any of those kind of things, then you are certainly going to be stimulating blood flow to the penis. And if you somehow make that system more efficient, you're definitely going to be getting a good result from your patient. Now, sort of going back to the back pain, it's astonishing how well the M-Sculpt works for back pain. So I have an L5S1 spondy, just like a 5 millimeter slippage, anterior slippage of the S1 on the L5. And so I got myself in trouble one time lifting something that I shouldn't have been lifting, and I experienced nerve pain like I'd never experienced. Musculoskeletal pain, you can kind of tough it out, but nerve pain is
different world.
Like a different world. And now I have empathy for people who are experiencing nerve pain like I never had before. And it wasn't until I got an epidural that I actually could even sleep. But I set out to improve my core, and by using the M-Sculpt device to build my core and teach myself how to stand properly, my back's been great. So that may be really something that you look into, is especially a lot of pain patients and back patients can't do crunches, sit-ups, and so on and so forth. And this, you just basically lie there and the machine does the work for you.
Yeah, that's amazing. Let's get into some of the other stuff. So like one of the questions we get a lot with this stuff is like testosterone replacement. And so, there's one part is like, can we fix some of the underlying mechanics of, creating an erection and sexual health? But what about the chemical and the hormonal responses to it?
So testosterone, I do a ton of testosterone replacement. And I'm a huge proponent of testosterone replacement if done properly. But that doesn't fix erections, right? Erections are entirely a function of the circulatory system. And so, after we talk about testosterone, we can talk about low-intensity shockwave therapy and PRP and some of those things and how they boost blood flow. Testosterone is the most important male hormone, bar none. And it's a growth factor, right? So when we're 12, we're these little scrawny kids, and then in 5 years we're 17, right? And our testosterone goes from 200 to 1,000, and we've grown a foot, and we put on facial hair and pubic hair, and our genitals grow, and our libido goes up, and we put on muscle, and our face is oily, and things change so dramatically because your testosterone goes from 200 to 1,000. Right, and then after that, your testosterone drops 1 or 2% every year. Okay, and then we live in a world that's filled with plastics and processed food and all sorts of crap. And so when they look at testosterone these days, it's about 30% lower than it was about 50 years ago. And then the thing is, a lot of us sit behind desks, and your body is smart. Your body says, how much testosterone do we need to make, right? Because their body doesn't make more testosterone than it needs to make, right? And so if you're a hunter, not like shoot a gun at a deer from a half a mile away, but, like an ancient caveman hunter where you're out on the prowl and you got to wrestle down a wild boar, you need a lot of testosterone because those wild boars are nasty and they don't want to be killed, right? And if you're a farmer, farmers work hard, but they're not wrestling wild boars. And so your body says, I need testosterone, but I don't need that much testosterone. And if you sit in front of a desk, doing whatever we do in front of desks, your body says, geez, I don't need that much testosterone. Let's take our energy and make other stuff. And so that's why testosterone levels are lower these days. And then 40% of men are fat or obese. And in fat, you convert testosterone into estrogen. So now our levels are even lower. Our estrogen levels are higher, and we have man boobs. right? So that's the deal with testosterone. So, going back to how do you fix testosterone? How do you get a higher level of testosterone? All those 9 things that I talked about. Don't drink, don't smoke, don't do drugs, don't eat too much, exercise every day, stretch, meditate, sleep. Sleep is really important, right? Because when is your testosterone highest? 8 o'clock in the morning. When is your testosterone lowest? Before you go to sleep. What happens when you sleep? Your body makes more testosterone, right? So if you're not sleeping, if you're doing the 2-3 hours, 4 hours a day of sleeping and think that you can cheat Mother Nature, guess what? You're wrong. You're not going to make testosterone.
Yeah, if that's not a good reason for people to start hitting the bed a little bit earlier and paying attention to sleep, I don't know what is. We've talked about sleep on this podcast a ton, so my listeners will certainly know. Like, to me, it's in those 7, the things that improve your sleep are often the low-hanging fruit that improve a lot of other things. And so if we are really paying attention and tracking our sleep and work to improve it, you're going to improve all these other areas of your life because of like the downstream effects of improving the sleep. But, it's amazing how much hinges on us getting that good, ideally 7 hours, 8 hours a night. Is there stuff that you give your patients to help with that if they're like, look, I just can't, I'm not getting good sleep? Is there activities, is there supplements, is there anything like that?
Yeah. So, I'm not a sleep expert. I know how to talk about sleep. I know how to convince my patients to get sleep. But so the book that I wrote, The 21st Century Man, it has a great chapter on sleep by Mike Murphy, who's a professor at Stanford. And so, I typically refer them to that book.
Oh, nice. Throw a tag in there and, hey, read this chapter, follow the rules.
Well, that book has a chapter on everything that a midlife man needs. There really isn't a chapter that's missing because, the book evolved over about a year or two of just seeing patient after patient after patient. And then, I'd talk to a patient and be like, that's a good chapter. We should have that chapter in there. And so, it comes from a 25-year career of patients asking me questions and me being available to sit and field those questions. And when I don't know something, I'm not one of those people that makes stuff up. Like, I was talking to a patient the other day about his prostate issues, and he was asking me, like, why is my urination so slow in the morning? My Kaiser doc told me that it takes a while for my prostate to wake up. And I'm like, I've been in urology for 25 years, and I don't know that the prostate has a waking up process. And so, I'm one of those people, if I don't know something, I'll look it up or I'll call one of my colleagues. And so, the book is just filled with 60 myself, but also 60 of my colleagues who are talking about the things that they have expertise in.
Man, that's, as an aside, I'm like 85% through with the book, and it has been probably a 3-year journey. So thank you for doing that, because I know the mental difficulty and the brain damage that it takes to get a book through fruition. So thank you for writing that for all of us.
Did you like the pain chapter? So Bill Longton. Bill Longton's amazing. He's an anesthesiologist, and he has a full-time pain clinic now, and he's Stanford trained, and he's a great athlete. I think Olympic trial swimmer himself, and he wrote just a fabulous chapter on pain.
Excellent. And we'll throw links to it, but let's get into a couple of the other things. So you talked about the kind of Gainswave. Tell us about that. What does that do? Yeah. Kind of explain that a little bit, because when I heard what that was, it's like, okay, we've got to dig into this a little bit.
Yeah. So the technology was discovered actually during World War II. So they were trying to blow up submarines, and the people that were in the water were getting massive internal injuries from the blast effect from the explosives, right? So you would think people would die from shrapnel, but in the water there's no shrapnel, right? But they would die from that shockwave, that energy wave that was coming through the water. And so in the 60s and 70s, urologists figured out that we could use it to break up kidney stones if we focused that energy on stones. But in 2010, there was a group in Israel that started using it for the treatment of erectile dysfunction at a much, much lower power. And what it does is it tricks your body into thinking that there's an injury. And when you have an injury in the body, you generate an injury response, and part of that injury response is a healing response, and part of the healing response is the growth of new blood vessels. And so by using low-intensity shockwave therapy, you can induce the body into activating stem cells and causing the release of growth factors, especially vascular growth factors, to cause what we call neoangiogenesis, or the growth of new blood vessels. Right? So it's not going to take a 75-year-old guy and make him into a 20-year-old stud, but it'll take a 55-year-old guy that is using Viagra but wants spontaneity and get that guy to the point where he doesn't need Viagra anymore. Or a 65-year-old guy where Viagra's not working so well, it'll get that guy to the point where, Viagra's working pretty well.
Yeah, that sounds like those two would kind of mesh up really well in some cases.
Yeah, because remember, Viagra and a nitric oxide booster boost the signal, but the other part of it is the pipes. You need to make sure that you're able to generate enough blood flow to get the blood at pressure so that you can block the backflow of venous blood. So we use that. We also use what's called platelet-rich plasma. So I don't know if in your pain practice if you use any PRP. Yeah,
we've certainly used and kind of gotten different types of injuries into PRP depending on how much damage was there, and I think we've kind of gone into it. I've got two questions. One, how is the PRP done in these instances? Like, are we treating the actual penis itself? And two, like going back to the Gainswave stuff, when you do a course of care, what does that look like? And does that create like a permanent change? They're pretty much done. They don't have to do monthly tune-ups or anything like that.
Well, I mean, in life, are you ever totally done?
Yeah. It's a valid statement. My patients are like, hey, I feel great doing these things. Do I have to do them the rest of my life? I'm like, your teeth are very clean after you brush your teeth. Do you have to brush your teeth for the rest of your life?
Yeah. Exactly. So typically, a younger guy, maybe 6 treatments, a guy in their late 60s or 70s, 12 treatments, usually once a week. And then I'll bring people back for maintenance. So a guy in his 50s, maybe once a year, maybe once every year and a half. A guy who's in his 70s, maybe more frequently, maybe every 3 months or something like that. And then you add the PRP. So PRP is what we call platelet-rich plasma. So the platelets in your body have 2 functions. So one is to cause clots, and we all kind of know that. But the other is to initiate the regrowth of tissue. Right? And it's actually like the good Lord put together this amazing system where when you're injured, your tissues call out for platelets with what we call cytokines or chemical signals. And so the platelets hone to the area of injury, and then they become activated. So when they become activated, they reach out their arms, they grab onto other platelets, they form this web that thrombin and other clotting factors get stuck to, and red blood cells get stuck to, so it causes a clot. But when they become activated, they release what we call alpha granules, which are packed with growth factors. And those growth factors initiate the healing response that we all get. Otherwise, we'd be all filled up with scars from our early childhood. And so what we do is we draw blood, we spin the blood down, we isolate the platelets, and then through a tiny, tiny needle, I developed an ultrasound-guided technique where I can deliver the platelets into the penis in a way that guys really hardly feel it.
I'm sure that's the hiccup point. Like, what do you want to do, doc? I'm willing to take any pill you want to give me, but no, trust me. This will actually get to the problem.
It was so funny. I was listening to this podcast with this guy that's like a professional lion tracker in Africa, and they were like, "Oh, you're so brave. How do you do that?" And I was thinking, like, I got some big patients, ex-NFL players and SWAT team guys and police officers. and I'm taking a tiny little needle and injecting it into their penis, and I'm in just this really vulnerable place, and I'm like, I'm much braver than these lion trackers.
I hope you're talking about Boyd Vardy too, because the lion tracker guy is amazing. That would be very funny. So in those situations, like, and they're coming off of these things, they're getting better. In a lot of these cases, like, are they getting, full erections? They're back to sexual health. What can people expect if they're going through something like that?
Yeah, I mean, a lot of it depends on what you go in with. And, there are other things that we do. We use, penis pumps and penile stretching devices and that, like I said, that M-Cella chair. But, yeah, I mean, guys come in really not being able to achieve a good erection and leave, super happy. That's the reason that I left a really big, successful urology practice to do what I do now, because I really kind of had to start over. But it's so gratifying when, guys come in and they tell me great stories, and they, you turn my life around, and, I'll always remember you, or whatever.
Yeah. And like you were talking about it, I was listening to one of your podcasts, maybe the one with Dr. Drew, and y'all were talking about kind of, how this affects people's lives. And I was like, I wonder if there's a study on sexual activity and health span or lifespan. Like, to me, if you are sexually active 75-year-old, because of all the intangibles that come around that, you have to have a better lifespan prediction than the non-sexually active counterpart 75-year-old. Yeah, I don't know if that study exists, but
yeah, well, I mean, there's a lot of kind of tangential studies to that, but I have kind of a Maslow's. One of these days, I'm going to have to put it onto paper. There's like a Maslow's pyramid of midlife men, right? And in the bottom is physical health. If you don't have your physical health, nothing else really is going to happen for you. But above physical health is mental health, is emotional health, is spiritual health, is relationship health, and at the top is sexual health, right? So if you're not physically fit, if you're not, if your emotions are okay, if you're not depressed or anxious, if your relationships are strong, then you get to the top where, you're frequently having intimate relations with your partner. And if that whole pyramid isn't built, guess what? Things aren't going to happen for you. So I agree with you. There's definitely a correlation between sexual health and longevity and happiness.
Well, it kind of goes back to what you said earlier, like the penis is a good barometer for overall health. Everything underneath it has to be good.
Exactly.
What about peptides? We talk about peptides in healing, and they've certainly come on the scene so fast in the last 5 years. And, you hear different things about the ability to create angiogenesis with different peptides. Is that something that y'all have used in your practice? What's your kind of thoughts on using some of those?
So I know a fair amount about peptides, and one of my favorite patients, he comes and visits me from out of town, and he's like, oh, yeah, I'm on all these peptides. I'm on, alpha-1 thymosin and BP-157, and he's rattling off all these peptides. And I just look at him, I'm like, dude, just lose 50 pounds first. So it's like, that's to me the issue with all these kind of like biohacker kind of things is just do the basics first. They're cheaper. There's a reams and reams of data on that stuff. Now, if you get to the point where you're doing everything right and you want to get to the next level, then peptides work great. I mean, we use PT141 or bremelanotide for erectile dysfunction. It works great in properly selected patients. The other peptide, I don't have nearly as much experience with, the thymosin alpha-1 and the BP-157. Really because...
Is it because the other things that y'all do for it worked so well that you haven't had to get into that world, really?
Pretty much.
Gotcha.
Pretty much.
So I think that's like, if someone is dealing with this, let's go back to the penis pump thing for a minute, because that was like a thing. I remember hearing people talk about it, even when I was in high school, and you're like, well, y'all certainly don't need it. You're 18 years old.
No.
But who could actually use that? And what does that actually do for somebody to improve, their, erectile dysfunction?
Yeah. So guys that aren't getting nighttime erections, right? So nighttime erections are the key to long-term erectile health, right? So you ever see the TV show Naked and Afraid?
I've seen an episode or two.
Yeah, so I love that show. If you watch the show, I've never seen two contestants be intimate with each other, right? And so, basically what they're doing is they're spending all their time trying to eat, trying to defend themselves, trying to make shelter, right? And even though it's a young hot guy and a young hot woman who are naked in the forest together, with no one around, they're not intimate with each other, right? And so when the female is in heat and the guy has to be ready to procreate, and if you're not getting exercise for your penis, then that you're not going to be able to deliver on that. And so that's the purpose of nighttime erections, is to keep our penis stretched, because all of my 70-year-old and 80-year-old patients say that their penis isn't as long as it used to be because it's not stretching the way that it should be. And you're not getting enough blood flow into the penis to get oxygen and nutrients in there. And so the purpose for a lot of my patients, what I prescribe it for, is to get the penis exercise, right? To stretch the penis back to the size that it was, and to get oxygen and other nutrients into the penis so that the penis can be more healthy.
Gotcha. Yeah, that makes a ton of sense. I never realized that, I know the fluctuation of testosterone, and you get that morning erection, and that, signifies a lot of different things, but I never thought, I guess, what the reason for that was, of how that would keep that area healthy. Cause you're like, was that because back in the day we woke up and we're like, we're going to be going hunt. So, hey, I've got to do this now. So let's go.
No, I mean, at night, every time you dip into REM sleep, into dream sleep, you should be getting erections. So you should be getting 30 to 60 minutes of erections every night. And so when you wake up in the morning with an erection, it's because you're waking up kind of in the middle of REM sleep.
This is kind of a little bit of an aside. One of the docs here in the practice is a vegetarian, and he sent me a couple of studies on plant-based diet and increasing and improving erection, and then another study on plant-based diet. It was retrospective, and it had a lower incidence of erectile dysfunction. We could dive into kind of the ins and outs of some of that stuff, but we do a 5-day fast. That's a fasting mimicking diet, kind of a la Walter Longo. I'm not sure if you're kind of familiar with some of that, but it's all plant-based. And the one thing I notice is my REM sleep during that 5-day window shoots up dramatically. And so I wonder if you're going on this kind of plant-based and we're getting better sleep, and so their erections improve from some of that stuff.
Yeah, well, I mean, the interesting, I wish I could go on a plant-based diet. I like meat. Sorry. It's just, and the thing is, people live to 100 years old eating meat. People eat to 100 years old eating vegan or vegetables or whatever. I think it's clear from the literature that a plant-based diet is much better for you than a non-plant-based diet. I mean, I don't think anyone can seriously argue that, but you can do just fine eating a reasonable amount of meat. But when we draw blood from people for PRP, we can always tell the people that are vegetarian, right? Because their blood is much less cloudy because there's not nearly as much cholesterol in there. And so, there's clearly a benefit to a plant-based diet. And, you're taking down a lot of stuff that makes a lot of nitric oxide. And Joel Kahn, who's a integrative cardiologist, wrote a great chapter in my book on plant-based diet.
I love it. What should we not do? The person, that's trying to kind of do with some of this stuff on their own. I'm sure you've seen more ridiculous things than we can talk about on this. But what's the stuff that people should not do if they're trying to get this part of their life healthier?
Yeah. Well, I mean, I think everyone knows that smoking is bad. Everyone knows that drugs are bad. Everyone knows that obesity is bad. Carbohydrates are, for a lot of people, really poison. And people don't quite understand why, right? So if you think about it, just really quick, a really quick biochemistry lecture to your listeners. Trees gather energy from the sun, and they take carbon dioxide, which is CO2, and water, which is H2O, and make sugar, glucose, right? And glucose is a combination of carbon, oxygen, and hydrogen, right? And then you package that up and put a lot of sugar molecules together, and you get carbohydrates or starches, right? And if you take too much of that stuff in, it gets converted to fat. And fat isn't bad. Fat is good, right? Because fat for animals is survival. Bears that hibernate all winter, they eat as much as they can, and then they go to sleep for 4 or 5 months. Look at animals before winter and after winter. You'll see animals before winter are fat, and after winter they're really thin. So fat is really important for survival. Now, if you take a protein are made out of amino acids, and amino acids have a nitrogen. So in order to convert a protein which has a nitrogen into fat, you got to get rid of the nitrogen. And that's really hard for your body to do, right? So eat as much protein as you want. And it's unlikely you're going to get fat. But if you eat carbs, like bread, cookies, cake, pasta, those kind of things, it's super easy for your body to convert that into fat. And your body doesn't know that when the next meal is going to be. So if you watch Naked and Afraid, right, in 21 days, maybe they eat 2 times.
Yeah.
Maybe they eat 3 times, right? So from an evolutionary perspective, your body's getting ready for a 5-day fast because you don't know the next time you're going to eat. So, one simple thing to do is eat more protein and much, much less carbs. The other thing is we've all been hoodwinked by marketing that alcohol is okay, right? When you're younger, you go
Especially
to the
down
LSU
here.
game. Yeah, you go to the LSU game and you drink beer, and then, you're sophisticated, so you drink wine, and then you go out with your buddies and you drink bourbon. So there was a famous study that appeared in the Journal of the National Lampoon out of Faber College, written by Dean Wormer. And the conclusion of that was that fat, drunk, and stupid is no way to go through life.
Love the reference.
And so really, alcohol does 3 things. One, it's empty calories, right? So it's nutrition without any nutritional benefit. So it's calories without any nutritional benefit. 2, it disinhibits us. So most of the stupid things that we do in life, we do under the influence of alcohol, right? And 3, it's a depressant, right? That's the class of drug that alcohol is in. So it makes you sad, it makes you do stupid things, and it makes you fat. And if we drank less of it, and believe me, back in my day, I drank more than my fair share of beer and whatever, but I haven't drank in about 10 years, just because my kids are becoming teenagers and we don't want to have that around. But if you really, really think about it, most of us drink out of habit. If you drink because you're addicted, go find an addiction specialist. You need help. If you drink out of habit, go find another habit. And if you drink because you really, really like the taste, like I like the taste of beer, right? So I'll have beer with sushi. But there are non-alcoholic beers that I can get the taste of beer from and not actually drink alcohol.
Yeah, so many people, especially down here in the South, it's so habitual, like it's social. And so if you just replace it with something else, your brain almost doesn't even know that you replaced it. You have the same amount of fun. It's the whole thing that you're just replacing it and subbing it in. I know we're coming up on time. You mentioned L-citrulline. What are some other things? My questions around some of the supplements is, should people be doing that stuff earlier in life? Like, in our 30, 40-year-olds, should they be taking some of these things? Should they be taking that and other supplements that would help in the long run? Is there some other things that they should be doing, right now and consuming besides the kind of exercise, making sure your weight's under control, making sure we're not sabotaging anything? Would those things move the needle later in life?
Yeah. So, there's really no downside of taking a nitric oxide booster. So there's only benefit in terms of blood pressure. I get a lot of my patients off their pharmaceutical blood pressure medications because there are a lot of side effects, especially on erectile function from those pharmaceutical blood pressure medications. So I get a lot of those guys off those by taking a nitric oxide booster. It improves cognition. It improves athletic performance. A lot of bodybuilders and elite endurance athletes take nitric oxide boosters. The other thing is, when my guys are working out, I have them take creatine. So creatine regenerates ATP. There's a huge literature on creatine. There's a huge literature on nitric oxide. I don't think anyone can dispute the benefit of those two things. Now, I also created a testosterone boosting supplement called Support, and that is for guys who have borderline low testosterone, right? So if I'm not going to replace testosterone for those guys, they have borderline low, but they're doing okay clinically, then that has DHEA, which is a testosterone precursor. It's got DIM, which blocks the conversion of testosterone to estrogen. It's got Tonkat Ali, which helps prevent the binding with sex hormone binding globulin. It's got some ashwagandha and some zinc and some magnesium, which you need to make testosterone. So, if your testosterone's kind of borderline low, that's a supplement that would be beneficial. I'm beginning to think about taking either NMR or NMN, which has some benefits in boosting ATP and NAD. So I'm sort of on the borderline of being convinced that it takes a lot to move the needle for me.
And rightfully so. It's good. I've been kind of going back and forth on the NMN, NAD thing, and we have gone through a few of different delivery methods. I will vouch for the suppository delivery method. I've had tons of patients do really, really well on getting it straight in there, even better than people do an IV, to be honest. So very interesting studies to come with some of that stuff. Dr. Brandeis, this is awesome. It's good stuff.
Hey, thanks for having me on. I really appreciate it.
I appreciate you coming on. We ask all of our guests if you could tell people to do one thing to improve their health today, what would that be?
Yeah, so the first chapter of my book is called The Hero's Journey, and it's based on this concept from Joseph Campbell, which is really that we all go on our hero's journey. And the key really is to be the hero of your own hero's journey, right? We all get caught up in other folks, in Tiger Woods or Johnny Depp. But, the thing that Johnny Depp trial kind of taught me, which I kind of already knew, is that you look at these people and you think, oh, he's a movie star, he's good looking, he's got money, he's got hot women. His life was so messed up, right? The things that his ex-wife said to him, and she threw a beer bottle that cut his finger off. I mean, would you really trade your life for Johnny Depp's life, right? Don't focus on other people's problems. Focus on your problems, what you can do to be a better spouse, to be a better parent, to be better in the workplace, to be better in your community. And if you do those things, then you'll more than likely make the right choices or choices that will benefit you in the long run.
Beautiful. Beautiful way to wrap it. The 21st Century Man, y'all can find basically everywhere that books are sold, correct?
Yeah. We're on, our website is the21stcenturyman.com, all written out in letters. Or you can buy it from Amazon and give Jeff Bezos some more money. or we're on Audible, we're on ebooks, we're kind of everywhere.
Check that out. Check out affirmscience.com. Do you have any social media that you keep up pretty well with?
Yeah, I have a YouTube channel. So I do a lot of physician teaching and a lot of public speaking. And so I put a lot of my things up there. Also, I do a ton of podcasting. And so my book website, and then brandeismd.com is my medical practice website. And then we get people flying in from all over the place to come see us because of kind of the unique things that we do.
I love it. I love it. Keep doing what you're doing, helping a ton of people live a better life. I can't thank you enough for coming on and really sharing some knowledge with the listeners and maybe opening some eyes to some things that people can do that, probably aren't talked about enough. But thank you so much, Doc.
Awesome. My pleasure. Thanks for having me on.